Hi, my name is Sahil Shah, and I believe we should keep full autonomy for nurse practitioners in Illinois. There are three key roles in a hospital that we'll be talking about today. First, a registered nurse. Second, a nurse practitioner. And lastly, a physician. Let's go see what each one does. What is a registered nurse or an RN? My slogan for them are they're the frontline health professionals and the face of the medical facility. They're the first people that a patient sees as they assess their conditions. They can record their medical history and their symptoms, and they can administer some treatments and medicines such as vaccines. Lastly, they brief the doctor before the doctor meets the patient. So how do you become a registered nurse? So first, you must have your undergraduate nursing degree, followed by nursing degree apprenticeship. Then you must complete nurse associate training. And lastly, you must complete postgraduate nursing courses. One step up from a registered nurse is a nurse practitioner. They are advanced practice nurses who deliver comprehensive healthcare services. They have advanced clinical education. They can perform physical exams. They can diagnose and treat diseases and other health conditions. They can prescribe medication, and they have shared responsibilities with registered nurses and physicians. So to become a nurse practitioner, you must first become a registered nurse. Then you must get your bachelor's degree, followed by nursing experience. Then you must enroll in a graduate program. Then finally, you can gain your advanced practice license. So what are the nurse practitioner demographics in Illinois? So in Illinois, they make anywhere from $117,000 to $137,000 a year, which is more than a registered nurse, but less than a physician. It is one of the fastest growing professions in the US, showing 46% job growth. It has a very good work-life balance as they're 40-hour work weeks with working on average 8 to 12 hours a day, which is pretty standard. On average, they are 43 and a half years old, but on the young end, they can be as young as 25, and on the older end, they can be 65 plus. It is primarily a female dominant career, as 86.9% of them are female and only 13.1% are male. The job outlook for nurse practitioners are showing really well, as it's showing exponential increase. From the year 2000, we only had 60,000 nurse practitioners in the United States, to now we have over 360,000 just a short 23 years later. So what is a physician? They're highly trained medical professionals who specialize in patient care. So they can be specialized, um, unlike a nurse practitioner. So they can be pediatricians, dermatologists, or they can even specialize in infectious diseases. They can order tests, they can diagnose and create treatment plans, and they can perform basic procedures. Lastly, they have shared duties with nurse practitioners, meaning that they can do everything a nurse practitioner can do, including watching over a nurse practitioner and all of these. So, but it is reflected in their education as they have to complete more education and it can be costlier, but the cost can be reflected back to their job pay as they are paid more. So first they must complete their undergraduate degree. Then they must pass the MCAT, followed by 4 years in medical school. Then they must complete residency and the U.S. medical licensing exam, followed by a fellowship and or continued education. Lastly, they must earn their board certification and they can get a state license. But physicians have full independent autonomy, unlike nurse practitioners in some states. So what is independent autonomy? So independent autonomy is when a healthcare professional can make decisions without external constraints, meaning that they can make whatever decisions they want without having someone higher up having to okay whatever they're doing or approve. So they also have unrestricted clinical choices, meaning they can make whatever decisions they want. But the one downfall is that they have full responsibility for their independent decisions that they're making, meaning whatever comes from the decisions they're making, good or bad, they must take full responsibility for. So some examples of independent autonomy is that they can have full treatment selection. They have the authority to prescribe whatever medication is needed. They can allocate resources within the hospital, so that can be either medicine or people. They can make necessary adjustments to the treatment plans for different patients. And lastly, they can conduct research for patients or groups of patients if needed. So which states grant full medical autonomy? So currently only 27 states grant full medical autonomy, which tend to be the western states, excluding California, and the northeastern states. Many of the southern states have no autonomy at all, with the midwestern states having limited autonomy. But recently, Illinois has changed their rule regarding their full practice authority, also known as medical autonomy. So in June of 2019, advanced practice nurses who have completed at least 250 hours of continued education or training and 4,000 hours of clinical experience can have can be granted full practice authority. So what are the key opportunities that come with this? First, it can improve the timing within a hospital. Second, it can aid with the elderly crisis. Third, it can help with the shortage of medical professionals. And fourth, with the growth of nurse practitioners, if we have more people with more autonomy, it can help the medical sector all across the board. So firstly, the waiting time in medical facilities. The waiting time has increased to first get into the facility. From the time you call to the time you can step foot is on average 26 days, which is way too long. And once you get the appointment, you can wait anywhere from 45 minutes to 120 minutes to see the doctor, which is also, again, too long. So if you have an increased amount of people with full autonomy who can see these patients and get through them faster, we can help lower this number. Next, it can help reduce the physician's workload. So 45.8% of physicians having reported at least one instance of burnout. Burnout is either mental or physical exhaustion, and that can be due to like the long hours. Is 56% claim to have extremely long hours. They can see anywhere from 20 patients a day or even 4 to 5 an hour. According to the Medical Association, burnout is a health crisis for doctors and patients because if we have doctors who are burnt out, they can't properly see the patient and make life or death situations, which can be very dangerous. So some things that are causing this physician burnout is the low control of pace. So it's a very high pace environment and it can be very chaotic. The electronic health instruments also have a play, along with the time pressure to see as many patients as they can to get through the increased number of patients. And they also have family responsibilities back at home. So, people tend to have longer life expectancy now, as in some regions it's more than double. So what can this mean for the healthcare industry? So the longer life expectancy, there's an increased need for elderly care, as the elderly are more likely to contract diseases or to get more healthcare problems. So back in 2021, we were able to have 7 healthcare professionals for one elderly, but now by 2050, it's going to decrease to only 3 to 1, which is not nearly enough. So there's not enough doctors or nurses to supplement this increase of life, and it's been dubbed the senior care crisis, which are affecting 56.4 million people over the age of 65. Next, there's a growth in nursing profession, especially for nurse practitioners in Illinois, which Illinois has some of the most nurse practitioners in the country. And for the employment outlook, nurse practitioners are growing 31%, which is the most in the healthcare industry. Lastly, it can align with international practices. So Canada is the most similar to the United States, meaning that different states and provinces make the rules based on whether nurse practitioners should have full medical autonomy. In the United Kingdom, they grant all nurse practitioners full medical autonomy. In Australia, they have full autonomy, but it may be restricted based on physician nurse agreements, but that tends not to happen too often. And in New Zealand, they have limited autonomy just like the United States, but they are granting autonomy to more and more nurses at a much faster rate than we are. So I think that we should keep full autonomy in Illinois to help with all of these. Thank you.